This is Dr. Eric Osansky, and in this video I'll be giving an overview of the GI map so that you have a better understanding of the different markers, and I'll also discuss what you can do to address some of the more common positive findings on this test. Before I begin, I just want to remind you that the main reason I put together these videos is to help people with different types of autoimmune conditions and other health issues better understand their test results so that they can find and remove their triggers, correct any underlying imbalances, and feel great again. I need to let you know that this video is not meant to be used as medical advice or as a recommended treatment protocol, and it isn't a replacement for consulting with a competent healthcare practitioner. The GI map is a cutting-edge DNA-based comprehensive stool test that has a high sensitivity and specificity. This panel not only tests for gut infections, but it also tests for some of the most important beneficial flora in the body, yeast and intestinal health markers related to digestion, immune response, and gut inflammation. Who should consider ordering a GI map? Well, anyone who is experiencing digestive symptoms might want to consider ordering this test, or a different comprehensive stool panel. Some of the symptoms commonly experienced with gut infections include stomach pain, gas, bloating, diarrhea, heartburn, as well as unexplained weight loss. Just keep in mind that the lack of digestive symptoms doesn't rule out gut problems. Another situation when you might want to consider doing a GI map is if you have other symptoms that don't improve over time. So this can include symptoms such as fatigue, brain fog, insomnia, muscle and or joint aches, as well as numerous other symptoms. Since a healthy gut is required for a healthy immune system, you might wonder if everyone with an autoimmune condition should order a comprehensive stool panel such as the GI map. I can't say that I recommend the GI map to all my patients with autoimmunity, but some practitioners do recommend such testing to all of their autoimmune patients. The downside of doing this test on everyone is that not everyone will need it, and thus they might spend money when it's not necessary. On the other hand, the downside of not doing this test is that it's possible that you might miss a key trigger or underlying imbalance that's a factor in your autoimmune condition. When discussing all the different treatment options for the findings on this test, it's important to keep in mind the 5R protocol. I'm going to briefly discuss this here, but look out for another video where I'll discuss this protocol in greater detail. Most of the findings on a GI map will incorporate one or more of the components of this protocol. The first thing you need to do is to remove anything that's having a negative effect on the health of the gut. This includes food allergens and gut pathogens. The second component of the 5R protocol is to replace certain factors which play a role in digestion, including digestive enzymes, stomach acid, bile salts, as well as dietary fiber. The third component of the 5R protocol is to re-inoculate with prebiotic and probiotic foods and supplements. The fourth component of the 5R protocol is to repair the gut. And the fifth component of the 5R protocol is to rebalance the body through stress management, sleep, and exercise. All of the pathogens on the first page of the GI map commonly cause intestinal gastroenteritis, and thus the person might experience symptoms such as severe abdominal pain, diarrhea, fever, as well as malaise. Now just to keep in mind that not everyone who has positive findings will experience such symptoms. In fact, I would guess that at least half of my patients who test positive for one or more bacterial, viral, or parasitic pathogens on the GI map do not experience gastrointestinal symptoms. When this is the case, one can make a good argument not to treat the person, but if the person has one or more positive pathogens in the presence of GI symptoms, then you want to consider treatment. So here we see some of the more common bacterial pathogens. Ideally, we'll want all the bacterial, parasitic, and viral pathogens to show up as less than DL, which means less than detectable limits. When looking at the bacterial pathogens on the sample report, we see that most of them are less than the detectable limits, although we also see that C. difficile, toxin A, and toxin B are red flagged as being high. On the other hand, you can see here that E. coli, O157, and Yersinia enterocolitica, down here, these are both detectable on this test, but they're not red flagged as being high. The reason for this is because while with both of these bacteria you see that the numbers are higher than the reference range, but the exponential numbers are both lower. So with C. difficile toxin A, we see that the value is 1.21 E5, and the key number to look at here is E5, or letter number combination is E5. So if you look at the reference range, you'll see that it should be less than 1.00 E3 over here. And of course, 1.21 E5 is higher than this range. On the other hand, if the value was 1.21 E2, it would not be red flagged as being elevated since the E2 is less than E3. When looking at E. coli 0157, you'll see that the value is 8.6 E0, and some might wonder why this isn't elevated since 8.60 is greater than 1. And the reason, as you probably now understand, is because E0 is less than E3. And when you look at Yersinia enterocolytica, you'll see that the value is 4.46 E1, and the E1 is less than E5. On the other hand, if the value was 4.46 E6 or 4.46 E7, then this would be red flagged as being positive. So how do you address bacterial pathogens? So once again, not everyone who has elevated bacterial pathogens will need to receive treatment. So in the example we just saw where both C. difficile toxin A and toxin B were elevated, if the person was asymptomatic, then they might not need to receive treatment. On the other hand, if they were experiencing gastrointestinal symptoms, then it probably would be a good idea to treat this person. When someone does need treatment, most medical doctors would recommend antibiotics to treat bacterial pathogens. And while this is an option to consider, herbal antimicrobials such as oregano oil and berberine are also options, along with high-dose probiotics. If someone tests positive for Clostridia difficile and they have accompanying symptoms, then they might want to take Saccharomyces boulardii as well. And you might wonder what approach you should take for bacteria that show up on this panel and thus are not less than detectable limits, but are also not elevated. So in the sample report we just looked at, we saw that E. coli 0157 and Yersinia enterocolytica were detectable, but they both were within the reference range, so they were not red flagged as being elevated. If the person wasn't experiencing any digestive symptoms, then you probably wouldn't put them on a treatment protocol. But if they were symptomatic, then treatment might be a good idea. So it really does depend on the situation. Let's now take a look at the parasitic pathogens, which include Cryptosporidium, Entamoeba histolytica, and Giardia. Once again, fecal contamination of ingested foods or water are common causes. Undercooked meat and raw milk can be the source of Cryptosporidium, which is a common cause of traveler's diarrhea. Giardia is the most commonly isolated protozoan worldwide and is found in lakes, streams, and ponds, but could also be carried by animals. And on this sample report, we can see that all three of these parasitic pathogens are less than detectable limits, which is great news. Let's now talk about the treatment for parasitic pathogens for those who have one or more positive findings. If the person is experiencing severe gastrointestinal symptoms, then prescription medications such as metronidazole might be indicated. For those looking to take more of a natural treatment approach, you can consider natural agents such as olive leaf, colloidal silver, monolaurin, or quercetin, along with high-dose probiotics. The two viral pathogens on this panel are adenovirus and norovirus. Both of these are mainly transmitted by fecal contamination of food and water, and both of these viruses can cause gastroenteritis. And you can see that both of these on the sample report are below detectable limits. So how do you address viral pathogens? Well, both of these viruses will usually self-resolve without any treatment, with adenovirus usually resolving in 1 to 2 weeks, and norovirus usually lasting about 24 to 72 hours. If you want to take antiviral herbs for either of these viruses, you could consider herbs such as olive leaf and cat's claw, and you could also supplement with vitamins A, C, D, as well as zinc. On this sample report, you can see that H. pylori is clearly positive, as it has a value of 2.9 E3, which of course is higher than the range here of less than 1.0 E3. On the other hand, if H. pylori showed up as being 2.9 E2, then it would not be red flagged as being elevated. You could also see that the GI map lists the virulence factors associated with H. pylori. These virulence factors represent the genetic potential for an H. pylori strain to cause pathology. And in this sample report, we can see that this person has 4 virulence factors positive. Quite frankly, I rarely see this many virulence factors elevated in my practice, although it's not uncommon to see a couple of these present. Be on the lookout for a separate video on H. pylori, as the GI map by far gives the most comprehensive picture of H. pylori. Most tests will simply tell you whether or not H. pylori is positive or negative, but as you already know by looking at the sample report, the GI map lists the virulence factors. H. pylori has the potential to cause ulcers, chronic gastritis, as well as stomach cancer. However, many people with H. pylori are asymptomatic. So how do you address H. pylori? Well, I'll talk more about treating H. pylori in a separate video, as there is controversy over whether H. pylori should be treated at all in some situations. If someone is experiencing gastrointestinal symptoms such as stomach burning and reflux, then it probably is a good idea to treat H. pylori. In addition, H. pylori can be a trigger of certain autoimmune conditions, and so if someone with an autoimmune condition tested positive for H. pylori, it might be a good idea for them to be treated. As for what type of treatment, prescription antibiotics are commonly recommended by medical doctors, and since H. pylori is becoming more antibiotic resistant, it's common for treatment to consist of 2 or 3 antibiotics, along with a proton pump inhibitor. Natural agents can also be effective, including mastic gum, DGL licorice, black cumin seed, garlic, and berberine. Now, towards the end of this presentation, we'll briefly cover the antibiotic-resistant genes for H. pylori, which is very important for those considering prescription antibiotics. Regarding the GI map, if H. pylori is present and there are also positive virulence factors, then without question you want to treat it. On the other hand, what approach should you take if H. pylori is present and there are no positive virulence factors? Well, according to the practitioners I've spoken with at Diagnostic Solutions, you would still want to treat H. pylori if it is elevated, even if there are no positive virulence factors. The next section looks at the normal bacteria flora and phyllomicrobiota. These commensal bacteria extract nutrients and energy from our diets, maintain gut barrier function, produce vitamins such as vitamin K and biotin, and they help to prevent the colonization of potential pathogens. Be on the lookout for a separate video that covers the normal bacteria in greater detail, but it's obvious that you want to have healthy levels of all of these and don't want to see any of them too high or too low. On this sample report, you can see that there is 1 low marker and 1 elevated marker. As for how to balance the bacterial flora levels, you want to incorporate the 5R protocol I mentioned earlier, but I would specifically focus on the replace and re-inoculate components, as you want to increase stomach acid, and you could do this by taking betaine HCl, bitter herbs, and or apple cider vinegar, and you also want to re-inoculate through prebiotic and probiotic foods and supplements. As for the Firmicutes and Bacteroidetes phyla, these dominate the entire human digestive tract, and if one or both of these are high or low, then this suggests that there is an imbalance of the normal microbes in the GI tract. In addition, a high Firmicutes and low Bacteroidetes may be a sign of impaired insulin sensitivity and or increased inflammation, and it can be caused by a poor diet, dysbiosis, maldigestion, or low stomach acid levels. According to Diagnostic Solutions, when Firmicutes is high, you should consider using bifidobacteria products and Saccharomyces boulardii, and improving your diet might also help to normalize the Firmicutes-Bacteroidetes ratio. On this sample report, you can see that the Bacteroidetes is low. Let's go ahead and move on to the opportunistic bacteria, which include additional dysbiotic bacteria and potential autoimmune triggers. So these bacteria only cause disease and illness in certain individuals, especially those with compromised immune systems. On the other hand, many people will have elevated opportunistic bacteria on the GI map with no symptoms. Keep in mind that these microbes are normal in the stool, but if the levels are high, then they have the potential to cause gastrointestinal symptoms such as diarrhea or constipation, as well as abdominal pain. Ideally, you want everything under opportunistic bacteria to be less than DL, which of course means that it's below detectable limits. On this report, you can see that there are a few bacteria that are clearly elevated, and there are also some that are detectable but are not elevated. Be on the lookout for a separate video where I will cover these opportunistic bacteria in greater detail, but I do want to discuss a few of these here. So Bacillus is found in spore-based probiotics, and so while high levels might result from reduced digestive function or constipation, if you're taking a spore-based probiotic, then you could expect this to be high. Although the GI map is looking at this large intestine, elevated levels of Methanoبacteria and or Morganella, as you can see here, These sometimes could be an indication of SIBO, or small intestinal bacterial overgrowth, but you cannot confirm or rule out SIBO through a stool panel since, once again, this test focuses on the large intestine. Higher levels of Pseudomonas, which you can see over here, as well as Staphylococcus and Streptococcus may be indicative of intestinal inflammatory activity and sometimes can result in loose stools. As for the potential autoimmune triggers, certain opportunistic bacteria can trigger autoimmunity or exacerbate the autoimmune component in someone who currently has autoimmunity. So, for example, Citrobacter and Proteus species along with Prevotella copri can be a trigger in rheumatoid arthritis. Klebsiella can be a trigger for Crohn's disease, ulcerative colitis, and ankylosing spondylitis. And on this sample report, you can see that Klebsiella is elevated. It's important to understand that if any of these bacteria are elevated on the GI map, this does not guarantee that they will trigger autoimmunity. It's also worth mentioning that gastrointestinal symptoms are less common when these bacteria are elevated. You could also see that there are a couple of bacteria that are detectable but are not elevated. So what treatment approach should you take for abnormally high levels of opportunistic bacteria? Well, of course you want to incorporate the 5R protocol I mentioned earlier. The presence of H. pylori is commonly accompanied by elevated opportunistic bacteria, and when this is the case, H. pylori needs to be addressed. Low stomach acid levels can also be a factor, and so this also needs to be addressed. Consider taking high-dose probiotics, at least 50 billion CFU per day. Natural antimicrobials might be necessary at times, especially if someone has gastrointestinal symptoms. Some examples of natural antimicrobials that can help include berberine, oregano oil, garlic, and olive leaf. Now, this doesn't mean that you should take all of these, and quite frankly, before taking any type of antimicrobials, it probably would be wise to discuss your results with a healthcare practitioner. Although fungal organisms are commonly found in the human digestive tract, fungal overgrowth is a concern, and unfortunately it is very common. Keep in mind that a negative stool test for fungi doesn't rule out an overgrowth of candida or other fungi. Organic acids can sometimes give a better picture of what's going on, and I'll cover this in a separate video. Also, remember that the GI map is looking at the large intestine, but it's possible to have fungal overgrowth of the small intestine, as well as other areas. As for the specific fungi tested on the GI map, you can see that they look at the Candida species, including Candida albicans. This is the most commonly seen yeast on the GI map, although sometimes you'll see one or more of the other fungi elevated. On this sample report, you can see that all of these markers are less than detectable limits. Here are some of the causes of yeast overgrowth. Prescription antibiotics are of course a common cause, but other drugs can also have a negative effect on the good bacteria, including proton pump inhibitors. Consuming a lot of sugar and starches can feed yeast and thus lead to yeast overgrowth. There is controversy over fermented foods, as some will advise those with a yeast overgrowth to avoid fermented foods, but this usually isn't necessary. First of all, certain fermented foods such as sauerkraut are high in bacteria, not yeast. But even fermented foods that are high in yeast won't necessarily worsen a yeast overgrowth. For example, if someone has an overgrowth of Candida albicans, drinking kombucha shouldn't worsen this, as the yeast in kombucha and other fermented beverages are different. Low stomach acid levels can be a factor in yeast overgrowth. Impaired immune function can also lead to yeast overgrowth. So how do you address yeast overgrowth? As for the different treatment options for fungi yeast overgrowth, you of course want to incorporate the 5R protocol. With any yeast overgrowth, it's important to reduce your intake of sugars and starches. Improving the health of the immune system is essential. It can be helpful to look at secretory IgA, as when this is low, this not only relates to a leaky gut, but a compromised immune system, which makes sense since you need a healthy gut in order to have a healthy immune system. Consider high-dose probiotics, as well as Saccharomyces boulardii. As for natural antifungal agents, you can look into caprylic acid, oregano oil, garlic, monolaurin, and olive leaf. Prescription antifungals may be indicated with severe cases. So here you can see that the GI map also tests for cytomegalovirus and the Epstein-Barr virus, both of which are below detectable limits on the sample report. And this can sometimes get confusing, as most of the time these viruses will come up negative in the stool, even when they are elevated in the blood. Look out for a separate video where I discuss testing for viruses in greater detail. What you need to understand is that if either cytomegalovirus or Epstein-Barr are positive on the GI map, this indicates an active infection. However, while the GI map can be a great test to look for pathogenic viruses that cause gastroenteritis, if your number one goal is to test for stealth viruses such as Epstein-Barr and cytomegalovirus, I would rely more on blood testing. So how do you address Epstein-Barr and cytomegalovirus? So as for the treatment of these viruses, I'll cover this in greater detail in a separate video, but just remember that these viruses are opportunistic, which means that if you have a compromised immune system, that they are more likely to cause problems. So you need to do everything you can to optimize the health of your immune system. Antiviral agents to consider using for these viruses include olive leaf, colloidal silver, monolaurin, and quercetin. Homeopathy can also be very effective for targeting specific viruses, but once again, you need to also work on improving the health of your gut and immune system. Of course, no comprehensive stool panel would be complete without testing for parasites, and the GI map is no exception, as it looks at some of the more common protozoa along with intestinal worms. Blastocystis hominis is a parasite that is commonly positive on this test, and it can be a potential trigger of thyroid autoimmunity. Not everyone who tests positive for blastocystis will experience symptoms, but some of the more common symptoms include diarrhea, abdominal pain, nausea, vomiting, fever, and fatigue. Fecal contamination of food or water is how it's commonly transmitted. In fact, fecal contamination is how just about all these protozoa are transmitted. You can also see the worms tested for in this panel. So, Ankylostoma duodenale and Necator americanus are hookworms, and infection typically occurs via skin contact with soil contaminated with larvae. Infected cats and dogs are another potential source of exposure. Ascaris lumbricoides is the same as roundworm and is usually transmitted through fecal contamination of water. And then here we see Trichuris trichiura, which is whipworm, and Tinea species is tapeworm. And look out for a separate video where I discuss both protozoa and worms. On this sample report, you can see that all of the protozoa are less than detectable limits, and there are no detectable worms either. So how do you address parasites? Once again, I'll discuss treatment options for parasites in greater detail in a separate video. Parasites can sometimes be difficult to eradicate, and therefore prescription medication is sometimes necessary to take. Some antiparasitic herbs that can be beneficial include black walnut, wormwood, oregano oil, and berberine. Mimosa pudica can also be beneficial for those who have parasites. I want to briefly talk about biofilm disruptors, as sometimes these are necessary to take. A biofilm is a group of microorganisms which form a protective layer that can make it resistant to antibiotics or natural antimicrobials. Many different microorganisms form biofilm, including H. pylori, Yersinia enterocolitica, E. coli, Klebsiella pneumoniae, and Candida albicans. Some natural agents which have been shown to dissolve biofilm matrix include N-acetylcysteine, proteolytic enzymes, colloidal silver, as well as monolaurin. Let's take a look at the intestinal health markers, starting with pancreatic elastase 1, which is a digestive enzyme secreted exclusively by the pancreas, giving a direct indication of pancreatic function. It's important to mention that while the lab reference range suggests that if elastase 1 is greater than 200 micrograms per gram, that it's normal, the optimal reference range is greater than 500 micrograms per gram. So in this example, we can see that elastase 1 is 388, which is within the lab reference range, but is less than optimal. Let's briefly discuss some of the common causes of low elastase 1, which include suppressed pancreatic function, low stomach acid levels, gallstones, cystic fibrosis, and being a vegan or vegetarian can also lead to low levels of elastase 1. So how do you address low elastase? Although taking plants or pancreatic enzyme supplements won't address the cause of the problem, it usually is a good idea to take these while trying to find and correct the cause. Since low stomach acid levels are a common cause, it's important to address this, and you might need to take betaine HCl or digestive bitters on a temporary basis. Chewing your food thoroughly is of course something everyone should do. Supplementing with bile salts may be necessary, but of course overall you want to address the underlying cause of the low levels. So let's take a look at the Steatocrit, which is a marker related to the absorption of fecal fats, as if the Steatocrit is high, this means that there are high levels of fat in the stool, and it is an indication of maldigestion, malabsorption, or steatorrhea. Let's discuss some of the causes of elevated Steatocrit. Pancreatic insufficiency is a common cause, which is why it's common to see someone with a low elastase have elevated steatocrit. A bile salt insufficiency can also be a cause, as can low stomach acid. It shouldn't be surprising that maldigestion and malabsorption are potential causes, and not chewing your food properly can also cause an elevated steatocrit. So how do you address high fecal fats? Some of the therapeutic approaches one can take for high fecal fats include to support digestion and stomach acid production, taking lipase, which is an enzyme that helps with the breakdown of fats, supplementing with bile salts or ox bile might be necessary, and of course you want to try to find and address any underlying causes of malabsorption, such as celiac disease or small intestinal bacterial overgrowth. So under additional GI markers, we have beta-glucuronidase and occult blood. So high levels of beta-glucuronidase may indicate dysbiosis and interference with phase 2 detoxification, including the detoxification of estrogen. So how do you address an elevated beta-glucuronidase? Well, you want to address any dysbiosis found on the GI map. Improving bacterial diversity through prebiotic and probiotic foods and supplements can help. You also want to support phase 2 detoxification and consider supporting estrogen metabolism by eating cruciferous vegetables such as broccoli, taking a DIMP supplement, or calcium D-glucarate. As for some of the potential causes of having a positive occult blood test, this can include hemorrhoids, a pathogenic infection such as Giardia, a bleeding ulcer, inflammatory bowel disease is a common cause. Cancer can also cause a positive occult blood test, as can intestinal polyps and upper GI bleeding. So how do you address a positive occult blood on the GI map? So if you have a positive occult blood finding on the GI map, you of course want to identify the source, and follow-up testing might be required. The GI map also tests for 2 immune response markers, which include secretory IgA and anti-gliadin IgA. Immunoglobulin A is the primary immunoglobulin in the intestinal mucosa, and it represents a first line of defense in response to antigens and pathogens in the gut, as well as other areas such as the respiratory tract. A low fecal secretory IgA usually means that the immune system is suppressed, and the person will also commonly have an increase in intestinal permeability, which is also known as a leaky gut. On the other hand, a high fecal secretory IgA is due to an immune response to antigens in the GI tract, usually a food allergen or an infection. On this report, we can see that the secretory IgA is within the normal reference range, although it is on the high side at 1873 micrograms per gram. So how do you address a low secretory IgA? Alright, so let's go ahead and discuss some therapeutic approaches for those who have a low secretory IgA, as you want to address any chronic infections along with any other microbiome imbalances found on the GI map. If chronic stress is a factor, then this also needs to be addressed. Consider supporting the gut mucosa with nutrients and herbs such as L-glutamine, marshmallow root, and the slippery elm. Vitamin A and zinc can also help to support the gut mucosa, and colostrum and immunoglobulins can also be beneficial. Now, please keep in mind that I do not recommend all of these to my patients. I do commonly recommend probiotic supplements, and Saccharomyces boulardii is a probiotic yeast that can be taken in supplement form, and this has been shown to increase secretory IgA in the research. If there are other gut imbalances, then of course these should be addressed. So how do you address an elevated secretory IgA? So if someone has an elevated secretory IgA, then they will also want to address any gut infections, although it's important to keep in mind that other types of infections can also raise the secretory IgA. Food allergies or sensitivities can increase the secretory IgA, and so if you're reacting to one or more foods, then this needs to be eliminated. Overall immune support can also help to normalize the secretory IgA. How do you address elevated anti-gliadin antibodies? So as for dealing with high anti-gliadin antibodies, when positive, this relates to an immune response to gluten. I'm not a big fan of this marker being present on the GI map, as I'm honestly not sure how reliable it is, as I've had multiple patients with elevated anti-gliadin antibodies on the GI map insist that they were strictly avoiding gluten. So if someone tests positive for anti-gliadin antibodies on the GI map, I would recommend doing a separate blood test to confirm this. That being said, if you're dealing with an autoimmune condition, it really is a good idea to avoid gluten, especially while you're trying to achieve a state of remission. Let's take a look at calprotectin, which is the most studied marker related to gut inflammation. So high calprotectin is a pretty good indication of gut inflammation, and extremely high levels are usually found in inflammatory bowel disease, especially ulcerative colitis. So on this sample report, we can see that calprotectin is 22, which is well within the reference range. So once again, when calprotectin is elevated, it means that you have gut inflammation. Extremely high calprotectin levels are found in inflammatory bowel disease, especially with ulcerative colitis. So how do you address an elevated calprotectin? Well, of course, you want to find and address the cause of the gut inflammation. If someone has gut infections or dysbiosis, you want to address these. You want to manage inflammatory bowel disease if you have ulcerative colitis or Crohn's disease. And of course, you want to address other factors that might be causing gut inflammation. If someone tests positive for H. pylori, they'll want to go to the ends of the report and look at the antibiotic-resistant genes for H. pylori. If an antibiotic-resistant gene is present, then that class of antibiotics is designated positive for antibiotic resistance. So, for example, if someone tests positive for H. pylori and the antibiotic resistance genes for amoxicillin is positive, this specific antibiotic wouldn't be a good choice to treat H. pylori. So on this sample report, you can see that the person has antibiotic resistance genes for clarithromycin as well as tetracycline, and so if they tested positive for H. pylori and if they chose to take prescription antibiotics, they would want to avoid these two. If you found this video to be valuable, please click on the like button below, and to get the latest videos to help you better understand your test results, make sure you subscribe right now and ring that notification bell, and I'll catch you in the next video.